Hello again from your host, Varsha Singh, for Healthline on TVAsia Telugu channel. Thank you so much for your loyalty to this program and continuing to watch it. This episode is another episode of integrative, complementary, alternative, and holistic medicine. As I have interviewed earlier prescribers and practitioners from other part of the country, I bring today someone who is practicing in United States of America. The integrative, holistic, alternative, and complementary medicine is a branch of medicine which practices something that is different from our modern medicine. But remember, this branch of medicine has a lot to offer as well. In today's episode, we are going to discuss something very important. The first aid. Now pay great attention because when we are talking about first aid, we always think about band-aids, antibiotic cream, medication that are antihistaminic, or something that we use for bug bites, fall, injury, and the first, our own trial to treat our symptoms. As a disclaimer, I would like to share that this episode is something additional that you can add in your medicine cabinet. But for any emergency, such as chest pain, stroke-like symptoms, any bug bite or bee bite that can lead to anaphylaxis reaction or where person cannot breathe, you have to go to emergency room to seek the treatment. Because remember, first aid is that we treat a symptom quickly, and if it is not improved, then you must seek care at emergency department because we want to keep you safe. At the same time, we want to bring you this valuable information, which is part of our integrative medicine, so that you can use those modalities as well to keep yourself healthy. So let's begin this interesting episode with Dr. Vijay Vaishnav, who is a practicing homeopath in United States of America. Dr. Vijay Vaishnav, I know him for years. He is an MD in homeopathy, and he has been practicing homeopathy for about 36 years. He has great experience. He and his wife, Daksha Vaishnav, they have set up a practice in the Bay Area of California, where they have been practicing homeopathy since 2012. And he is here with us on Healthline TVAsia Telugu channel to share his expertise. So welcome, Dr. Vaishnav.
Thank you, Varsha. It's been a pleasure to see you again after a long time and an honor to be on TVAsia.
It's really wonderful to have you here so that you can share your expertise just the way you taught me. I cannot forget my cardiology lectures where you taught EKG and all those trick of 5 minutes of physical assessment. So I hold you in great regards. You are an expert in clinical sciences as well as in homeopathy. So Dr. Vaishnav, I want to ask you, can you tell our viewers about what you do and what is your practice all about?
Yes, I have been practicing since 1985. So that's a long time ago. And apart from practicing homeopathy, I was also a professor and the chair of the Department of Materia Medica at a very prestigious college, Homeopathic Medical College in Mumbai, in India. And I taught there for about 25 years. I have also been a faculty for the practitioner and doctoral programs in homeopathy. This is in the United States at the American Medical College of Homeopathy at Phoenix. And I have been a visiting faculty for the Caduceus Institute of Classical Homeopathy in Santa Cruz in California. I've also taught at the National College of Naturopathic Medicine. And apart from all this, I have also been involved with research in homeopathy. And I was a subject matter expert at the Central Council for Research in Homeopathy, which is run by the Government of India, and have also added my contributions in the form of books and monographs and research publications in homeopathy. So I have been using my 30 years of teaching experience. I'm actually practicing what I preach. So what I've been teaching people, I actually put in practice and make sure that the patients get the best that they can out of homeopathy.
And that's why, Dr. Vaishnav, it's really a great honor and privilege for me to bring you on this show. So when we are talking, before we go on the main topic of the first aid in homeopathy, using homeopathy, our viewers, I really want to get a little bit more insight into what is homeopathy and how different it is from the mainstream medicine. That way, you will be able to explain them the underpinning of the scientific underpinning,
Right.
and viewers will get the right understanding of what you're going to say further in our episode.
So that's a question that a lot of people ask us in the United States. What is homeopathy? On the West Coast, homeopathy is very popular compared to the East Coast maybe and the rest of the US. People are more open to alternative therapies in California, in the state of Oregon, as well as Arizona, Nevada. So here people know what homeopathy is, but I think it's important for everyone to know what homeopathy actually is. So homeopathy is a holistic system of medicine, and all it does is it assists the natural tendency of the human body to heal itself. So we do not give antibiotics, we do not give steroids, but we give homeopathic medicines or remedies that help to build your immune system, and that makes it easy for you to fight any illness, whether it's an immune related disorder, whether it's an infection. We actually make your body strong enough to fight it. Now, the word homeopathy comes from two words. It's a Greek word actually, and it means there are two words: homeos, meaning similar, and pathos, meaning suffering. So to translate it literally, it means similar suffering. And the treatment is based on the law of like cures like. Now, this law is not something that was invented recently. If you actually study the old books of medicine in India and even the Vedas, they have talked about Vishasya Aushadam Visham. That means the treatment of poison is poison. So you give something that is similar to what has caused the disease, and you could expect this to take care of it. Now, this was founded by a German physician. He was an MD, and he founded homeopathy about 200, slightly more than 200 years ago. Now, so how does it work? Let me give you a very simple example of how you can understand what is the principle behind homeopathy. Most of you people have experience when you cut an onion, you would experience sometimes a runny nose, there'll be an irritation in the throat, and you might start wiping your nose and the eyes because there's a lot of lacrimation or watering of the eyes. So these symptoms, if a homeopath finds in a person who has maybe respiratory allergies or has got an acute cold, he would give the homeopathic remedy allium cepa, which is prepared from the red onion. So you see, like cures like. The red onion, it produces symptoms that are similar to colds or upper respiratory allergies. And we give in homeopathy allium cepa, and it helps take care of this. This is a very simplistic definition and understanding of homeopathy. It's much more deeper and much more complex. But to make it easy for the viewers to know what homeopathy is, I think this is a very simple way of putting it forward. You could also take another example. Some of you might have, in some time of your life, been bitten by maybe a bee or stung by a bee. And when that happens, the skin swells up, it turns red, it starts burning and starts stinging. And you need to splash a lot of cold water to help bring about some improvement in that sensation. Now, if a person comes with hives, for example, or urticaria, with the same symptoms of stinging, burning, red, swollen skin, better by cold applications, then a homeopath would prescribe the drug Apis mellifica, which is prepared from the honeybee. So you see, like cures like.
Apis mellifica, or I would say Ilium cepa. If you go to a pharmacy, you might not find them in the medicine aisle, just
Right.
like how we find Tylenol
Yes.
or Allegra or Claritin. So what's the difference between homeopathic medicine and conventional medicine?
So there are two things. One is, where will you find these remedies if you want to buy them yourself for taking care of minor problems? You will find them in Whole Foods. You can find them in Sprouts. You can find them sometimes even in Walgreens. So there are special aisles for homeopathy and alternative medicine where you might be able to pick up these homeopathic remedies and use them if they have been prescribed by a homeopath, or if you have some idea about how to use them. But otherwise, how is it different from conventional medicine? Well, conventional medicine was during Hahnemann's time called allopathy. And Hahnemann was the person who actually coined this term allopathy, which means the treatment was based on no fixed principle. So in homeopathy, we have a fixed principle, like cures like. While in case of conventional medicine, at least in those days and even now, multiple drugs are given to a person. So if you have come with headache, sneezing, runny nose, body ache, and fever, you might get 3 or 4 different medicines. One would take care of allergies, one would take care of your headache, one would be an antibiotic. So you end up getting so many different medicines at the same time. And sometimes they give medicines to cause an opposite reaction. For example, if you have diarrhea, they'll give something to stop the bowel movements, and you might end up getting constipation. Or if you have constipation, you might be given something that helps to evacuate the bowels, and some of the people end up having diarrhea after that. Sometimes painkillers are given, or steroids, and they have their own side effects. And to take care of those side effects, then they have to add some more remedy, some more drugs to help take care of maybe the stomach acidity or maybe skin reactions. So you end up having multiple problems coming as a result of the drugs that have been given to them. Now, a simple analogy would be a runaway train.
Mm-hmm.
There's a train that's on the tracks. The engine driver that has somehow collapsed, and the train, no one is there to stop the train, and it's now speeding on the track. Now, how do you try and control this train? There are different ways to stop it. In conventional medicine, one of the things that they might do is run a train on the same track in the opposite direction, and you have a head-on collision, you have a crash. But what happens with that? There'll be collateral damage. There'll be sometimes loss of lives, loss of property, there'll be a fire. Now, the same thing happens in the human body. If you give something that goes against what's going on, it ends up with a lot of side effects, and the person ends up having fire, like burning in the stomach, acidity, or they end up getting joint complaints, or they end up getting some other symptoms that appear. Now, what would a homeopath do in such a situation? Homeopathy is like cures like. So what does a homeopath do? He would ask another train to be driven on a track which is parallel to the runaway train. Slowly, the speed of the train will increase till it is running neck to neck with the train. Then it's possible for you, when they are both at the same speed, to somehow transfer one person from the relief train into this runaway train and help control the engine. So you're now, what you're doing is you're going on a similar track, like cures like. You are also making sure that there's no collision, there's no crash, and you're doing something that can be done in the safest possible way with the least amount of damage to the rest of the things around it. So you give homeopathy and you can make sure that there are no side effects.
Thank you, Dr. Vaishnav. I like the analogy that you have given about how the homeopathic process works. And I also understand the way you explain how the mainstream or the conventional medicine is mostly the symptomatic relief of the symptoms, while for each symptom, there is a separate medication. While in homeopathy, the way you explained, it's a holistic medicine and using the WHOLISTIC that considers the person as a whole, and you pick probably just one medication to address a group of symptoms. So my question is, you talked about the side effects when someone is taking conventional, and you gave great examples how the side effects are going to be produced. So in homeopathy, when they are prescribing medication, they usually say there are no side effects, and that you explain through your example of two trains running parallel where there is not going to be any crash. So the further question now, the viewers will be thinking like, okay, I have a headache, I have nausea, I have vomiting, I'm sneezing, and I know that I may have to pick up at least 3 medication from the conventional medication aisle. Now, if I want to look for management through homeopathy, so how can I treat myself as a patient who has all these set of symptoms?
It is possible for even lay persons who are not really homeopaths to learn how to utilize the excellent homeopathic remedies for simple solutions like first aid solutions for injuries, for cuts, as we were talking about earlier, for stomach upsets, for colds. It is possible for you to take care of yourself if you have a slight or minimal functioning or idea about how homeopathy works and some of the important remedies. I can actually walk you through some of them so all of you can maybe make notes of it and maybe use it in practice. Yeah, let's look at some of the things that homeopathy can help with. The simplest would be, as you said, first aid. So, and again, just as you said, if it's an emergency, you need to go to the ER or to the urgent care. Don't try to heal yourself at home just because you heard someone say something on television or you read something on a blog. It's always good to make sure that you go to the right medical practitioner and make sure that your health is safe. You don't take something that is going to cause more harm to you than good. But let's look at the first aid. It's very common for people to fall, especially kids. They always end up running and then they fall, or they're on the bike, they're learning to cycle and they fall, and then they end up getting bruises. You might see a bump on the head. Some of you unfortunate people might have rolling pins on your head sometime or the other in your life, and then you might end up having bumps. So when you have these bruises, when you have falls, when you have blunt injuries where the skin has not opened up, then usually a homeopath would consider giving the homeopathic remedy called Arnica montana. Now, Arnica is almost a household name amongst many people. I've seen this even in California where we practice, whether we are dealing with the South Asian community here or we are dealing with the Caucasian patients who come to us. Everyone seems to know what Arnica is because unfortunately they have the wrong idea about Arnica. It is not a painkiller. It's not like you take Tylenol and your pain goes away. It doesn't work that way. It works only for specific types of problems. And that is when you have a fall or an injury, you hurt yourself, you get a bump and you have a sore, bruised feeling everywhere. Think of Arnica for that. Now, on the other hand, if you have overstrained yourself, gone on a long hike, or you decided to suddenly start Zumba, all of a sudden you decided, I want to start getting healthy. So you start Zumba or you do yoga or you start running or you lift heavy weights, like you're shifting the furniture. So anytime there's a strain or an overexertion where your ligaments and your muscle tendons are all stretched and they are painful, then the homeopathic remedy Rus toxicodendron or Rustox would be what might help you. If you have had the unfortunate experience of falling somewhere and breaking a bone, symphytum, is the remedy you should think of. My mother is over 91 years old. A couple of years ago, she just sat down too hard and she crushed her vertebra, one of the bones of the spinal column, or the vertebral column. And she had severe pain. She was not a candidate for surgery, and we didn't want to give her the narcotic painkillers for that pain. So we gave her Symphytum. Symphytum not only relieves the pain, but it also helps in forming a good bridge between the broken bones. So what we call in medical terms as a callus. So the broken bones, when they are close to each other, Symphytum actually forms bridges of calcium across the bones, and it seals them. So we have seen that usually when you give Symphytum, you can actually hasten the recovery by almost 2 weeks. Usually you keep your upper limb in a plaster cast for at least 4 or 5 weeks after you had a fracture. It's possible that if you take Symphytum, your cast may be out in 3 weeks or maybe 4 weeks. If you have a lower limb fracture, usually you need an 8-week cast, and homeopathy might bring it down to 5 to 6 weeks. So it's possible for you to actually become much more ambulatory and get back to your normal healthy life with the addition of homeopathy. Of course, here what is you have to remember is if the bones are broken and they're separated apart, they have to be brought back and fixed together. Homeopathic medicines are not going to actually join the bones together. That's where your orthopedic surgeon would be required. He might have to fix it, make sure that they're well aligned, and then the homeopathic medicine will work in forming a good bridge and making a strong bond between the two broken bones.
So this is a great point that you have mentioned just now, that homeopathy is actually going to work with the mainstream management of any fracture. So it will work as a complementary to how the orthopedic surgeon is going to do what is necessary. And then early promotion of callus formation or early healing is that's where homeopathy can assist patients. So I'm sure you have many more medications to cite other than these 3.
Yeah, so one of the things that very commonly is used is calendula. It is the marigold, and calendula is basically for cuts and lacerations and tears of the skin. So that you fall and you hurt yourself on the knee and the skin tears open. You can always use calendula to make sure that the wound will heal faster and the scarring is less. After surgery, in India, in the hospital where I was teaching, we used to advise calendula to our patients after surgery because it helped in good wound healing. The sutures which were taken would heal much better. The scar would be very minimal. In fact, in the First and the Second World War, the surgeons who were in the field with the army, they used to use calendula on the wounded soldiers to bring about rapid healing. This is something that people may not know, but that's the beauty of calendula. Even the conventional doctors are known to use calendula for healing.
Thank you, Dr. Vaishnav. So, is there anything else that we can share with our viewers about other medications that they can use for the first use?
So for first aid, you could think of, like as we said, insect bites. One of the drugs is apis, which is the honeybee that we talked about. And another one is a drug called ledum that also helps in insect bites. If you have burns, you could think of a remedy called cantharis, which will help prevent the blisters from forming. It will help take care of the burning sensation, and it will prevent scarring. Unless, of course, those are very deep 2nd and 3rd degree burns, then again, you need the help of the surgeon to help take care of the healing, or at least take care of the wound. And homeopathy works as an adjuvant along with the conventional treatment. Sometimes you get injuries with pointed instruments, like when you're stitching or sewing and the needle goes inside, or a thorn while you're gardening goes into your finger or your thumb and it starts hurting, it's painful. Or you're walking and there's a sharp tack and it enters your skin, the sole or the heel. That's the time you could think of homeopathic remedies like hypericum and ledum. So these are some of the simple things you can do for yourself at home. You can also, apart from, if we have the time, I can talk about some of the other uses of homeopathy that the viewers can make use of at home without rushing to a doctor if they are very simple, minor ailments. So, for example, in babies, teething troubles, especially for first time parents, it always scares them. Whenever the child has some issue, they always get scared and they keep rushing to the pediatrician. Now, for easy teething, there is a homeopathic remedy called Calcarea phosphorica. So it's basically calcium and phosphate, and those are required for the growth of the bones and the teeth. So Calcarea phos will be very useful for such people. Children who are very irritable when they have the teething process that has started, they start getting diarrhea, they become very cranky. You could think of a drug called chamomilla, which also helps in reducing the inflammation of the gums, and it allows the teeth to come out without major problems that the child would have to face. Now, there are some kids who, for example, have teething that is delayed. Usually, you would expect anytime between the 5th month to the 8th month that the tooth would start erupting and then the other teeth start coming one after the other. Sometimes you have these really fat, chubby babies, very sweaty babies. They might have a sour smell from the whole body, and their teeth don't seem to erupt. So there seems to be some sort of calcium metabolism problem. We could give a homeopathic remedy called Calcarea carbonica, which would help bring about healthy and proper teething.
Dr. Vaishnav, I am just wanted to point out that the way you are describing, even the medications that can be used in the first instance, but you still look at the type of the personality
Yes.
and what we call it as constitution, because basically homeopathy is an individual medication for
Right.
each and every person. That's what I have learned. And sometimes the first aid medication can be also different for different person, right? So I will again, just the way you are going to point it out again in this episode, that it always makes sense to consult a homeopath, especially in case of children, when there is a doubt and when someone is not sure that am I doing the right thing. Do we have any more medications that we are going to cite for our first line of management before we go on our next question?
Yeah, so the other thing that sometimes people have to deal with is gas. Very common problem. Not only do the patients suffer from it, but they also make the other people around them suffer because of either the sounds that they make or the smells that they create. And homeopathy can be useful in such people too. And it might be given more like a stopgap treatment till they find out what's going on and before they meet the doctor, just to help them relieve themselves of the tension in the stomach, the gases, the bloating. So if you have people who come with such a problem, when you have gas which is in the upper abdomen and it seems to be pushing up, and then they have breathing problems, then they feel, oh, I got a heart attack because there's some pain in the left side of the chest. It's all because the gas is going up. Make sure that you also visit your doctor because it could be a heart attack in some of you. So you don't have to always believe that you only have a simple gas problem. When you feel that it's not going down with whatever you do, or you have some other symptoms coming up, you should visit your doctor and make sure that everything is clear. But if it's just simple gas, mainly in the upper abdomen, then the homeopathic remedy Carbo-Veg can be considered. When the whole abdomen is bloated, it's distended like a drum, and however much the person tries to pass the gas, there doesn't seem to be any relief, then we give a homeopathic remedy called Cinchona. When the lower part is affected, the lower abdomen, then usually Lycopodium would work and relieve the patient of his acute, distension, and the suffering. Now, the next thing that is very common with many people is constipation. Constipation could be a result of the conventional treatment that is going on. There are certain drugs that are given for cough, which contain codeine, that would cause constipation. And then there are certain narcotic painkillers that can also lead to constipation. Or constipation could be because of the fact that the patient has a very slow digestive system. The movement of the intestines is slow. So if you have a person who's developed constipation because of these drugs, the conventional medicine, and they've got the side effects of it, one of the important remedies for the bad effects of these drugs is nux vomica. Sometimes they'll get an urge to pass the motions, but nothing happens. They get severe cramps. They go to the toilet and there's nothing that happens. Or in some people, there might be very dry, hard, large stools. For a number of days, they may not pass any motions. You could think of the homeopathic remedy called bryonia. Most of these are plant-based. So you'll find that most of the homeopathic remedies are found in nature. So man has harnessed nature to help heal himself. So most of these are natural substances. They're not chemically produced. They are all found in nature, and they're just being used by the homeopaths to help the human, the people recover quickly. Now, there are some people who might have constipation where the stools come out and then they slip back again. And there are people who have to then use the fingers or have it removed mechanically. Such people require a homeopathic remedy called silica. Now, silica is basically just sand, but it has been specially gone through a process of potentization where it is serially diluted, and it's made much more powerful than it is in the crude inert form. And this is going to help with the intestinal motility, and it will help.
Thank you, Dr. Vaishnav. It makes sense just to understand how differently each homeopathic medicine is indicated for different kind of ailment, especially gastrointestinal, lack of motility, or having no control over their voluntary muscles, basically. And anyone who is suffering from either flatulence, which is called bloating, or constipation, it's nice to know that there are options out there so that they don't have to fall into a medication that can cause stop the diarrhea, at the same time a medication that can stop the constipation, but it can have a side effect which is exactly opposite.
Right.
So I wanted to now go into a different direction from discussing about first aid. I want to go into a different tangent and ask you about application of homeopathic medicine in chronic condition. And I'm sure you have a couple of case studies that you can share with us while you are talking about the efficacy and how homeopathy can help people in those similar chronic conditions. So I will start with asking you what are those chronic conditions where the viewers can think about using homeopathy?
So in fact, homeopathy is very effective in all sorts of chronic diseases. And how do homeopathic remedies work? So homeopathic remedies, they actually work on the neuroendocrine system. That's your nervous system and the hormones. They also work on what is known as the reticuloendothelial system. In other words, in simple words, that is the immune system. So the homeopathic remedies, when they're given to you after a very detailed history, where the person's physical state, as well as the emotional state, as well as the family background, the illnesses that the family has gone through and the person has gone through in the past, all that is taken into consideration when you're dealing with a chronic condition. So we would deal with everything together, and we try to bring a balance, the balance in the hormones, a balance in the immune system. So someone who has got a hypersensitive immune system, we bring it back to baseline. Someone whose immune system has dipped, like for example, they were on steroids for a long time, and steroids suppress the immune system. So homeopathy tries to bring it back again to baseline where it should normally be. The same with the hormones. If the hormone, for example, the thyroid hormone, the thyroid gland is not functioning well, we give the homeopathic remedy based on your holistic, individualistic approach where we deal with you as a person. And we give a medicine that brings the hormonal levels back again to baseline. So that is why you find homeopathy becomes very useful in lots of chronic conditions like hypothyroidism, polycystic ovarian syndrome, autoimmune disorders like rheumatoid arthritis or RA, lupus or SLE as it is called, ulcerative colitis, even allergic diseases like spring allergies, like asthma, eczema, hives, and even food allergies. We've had lots of children with food allergies where they were allergic to certain things in the diet, and after homeopathy, it's not going to be magic. It doesn't happen overnight, but we gradually fine tune the immune system so that they don't react to all these different allergens. Now, another condition that is very important, or other one type of disease, is the psychosomatic disease. That's where homeopathy plays a very important role, because psyche is the mind, soma is the body. Sometimes the mind and the body are so interlinked that the mind can cause a lot of physical symptoms. And a homeopath, he actually or she will look at your mental state and your physical state and then make a prescription. So many conditions like hypertension, like diabetes, like bronchial asthma, like hyperacidity and peptic ulcers, they are all psychosomatic in nature. And you will find that homeopathy is going to work very well in these conditions, because as homeopaths, we look at your emotional state and your physical state and make sure that both of them strike a balance. And we try to bring you back to the state of health. So we don't treat different parts of the body. So we're not going to treat your diabetes. So we don't treat your pancreas. Or if you've got joint complaints, we don't just treat your joint, but we treat you as a person who has diabetes, or who has high blood pressure, or who has arthritis, or who has acidity. So that is why a homeopath can treat multiple diseases at the same time with one homeopathic medicine, because he's treating you as a person. And when he treats you as a person, he looks at everything about you, and he's actually giving you a remedy that is catering just for you. So it is an individualized sort of treatment.
Great explanation. And when you were talking about the psychosomatic part of the homeopathy, it reminded me of what Dr. Samuel Hahnemann has actually written, that all our outwardly manifestations, which are our physical symptoms, are actually due to our internally deranged vital force. That's our psyche. It really resonates what you said. So going further, I'm sure you have a number of examples to share.
Yes.
So you can share a couple of them.
Sure. So now these are difficult conditions. Chronic conditions are very difficult, and you should not try to solve them or resolve them on your own. And these are complex ailments, and trying to do them on your own is not going to work out. You need to visit a homeopath, a person who has got a good amount of experience treating chronic conditions, and let them take care of you instead of trying to treat yourself for many of these difficult chronic conditions. Now, let me give you some examples. There are some slides that you'll see of patients' pictures before and after homeopathy. There was this 4-year-old boy who came with a growth under the great toe. There was under the toenail, he had a very painful growth, and he could not even walk. The toenail was deformed, as you'll see in the slide. And if he wore shoes, he just couldn't walk, because the shoes used to touch the toenail and it used to cause him a lot of pain. So this was a case of subungual warts. So basically, these were warts under the great toe, under the toenail actually. Even though he was a small child of just 4 or 5 years, we still needed a detailed history. And we actually also asked a lot of things about his emotional state, his food likes and dislikes, how he behaves with other kids, his social interaction, his other illnesses that he had had. And we gave him a homeopathic remedy, which, as you can see serially one by one in the slides, it rapidly caused a regression of the wart, and the nail came back to its normal size. Now, here we did not need to do anything like cauterization. Generally, with conventional medicine, when you have warts, they would cauterize it or they would burn it, either by chemical cauterization, where they use sometimes silver nitrate, or cold cautery, where they freeze it and they burn that area. Nothing is needed because homeopathy is very safe and gentle, and it causes the things to reverse themselves. We didn't even need to even think of having his toenail removed so that the wart can be tackled after that, because on its own with the homeopathic medicine, the toenail came back to normal. So that's one very important, a very good example of how you can treat small kids without exposing them to surgical or other things that could cause, again, a harm on the psyche. Kids are very impressionable and vulnerable, and if you can give them something which is very gentle and safe, and it causes a quick removal of the symptoms, it's much better than making them go through maybe the surgery. So remember one thing: warts and homeopathy are famous. Most people know, and in fact, even the skin specialists here in the Bay Area, whenever they have patients with warts, they send them to us because they know that homeopathy is possibly the best way to treat warts. And when you have warts, you should visit your homeopath. Make sure that you get yourself treated by a homeopath so that there's no suppression, but a cure of the warts from your body.
Thank you, Dr. Vaishnav. So when you're talking about skin ailments, the another condition that really comes in my mind is related to the hair on our head. And everyone wants to have beautiful hair.
Right.
And if anything happens to that part of the body, they are really worried about it. And one of that condition is the patchy hair loss, which is also known as alopecia areata.
Right.
Can you give us an example if you had a patient with this
Yes.
condition?
In fact, that patient was diagnosed by his barber. So that's the best part of it. So he went for a haircut, and his barber said, "Hey, do you know you got no hair on your scalp?" And the guy said, "No, I never knew that." And he says, "Yeah, you got a big patch. You should go and see a doctor." So he promptly came and saw us as homeopaths because he was taking treatment in the past from us, and he thought it's high time he came back to us and see if he could have this treated. So alopecia areata is when you have patchy hair loss. You can have ring-like hair losses. It could be one patch, it could be multiple patches. We've had some kids who have had alopecia totalis, where they've lost all the hair from the scalp. Usually, this is again an autoimmune disorder. And in 2 or 3 of those kids, we also found that they had an autoimmune thyroid disease. And that's where homeopathy scores, because you're treating the hormones as well as the immune system. As I told you earlier, we are trying to bring about a balance. And all these kids, the hair growth came back to normal. Now, in this person, he was much older, and we gave him the homeopathic remedy again after taking a detailed history. So remember, it's even though it looks like just one small part of the body, you still need to go through a detailed history, because we are trying to make sure that your whole health, the whole body starts becoming healthy, not just one part of your body. Now, how do you treat this in conventional medicine? You would possibly go to a skin specialist. They would give you injections of steroids into the scalp and hope that the skin starts responding and the hair follicles start growing again. So some people don't mind doing that, but there are many who don't like to have steroids injected into the body. And homeopathy would be a much safer alternative for it. As you can see, this patient's hair completely came back to normal after homeopathy.
Thank you for sharing that and giving that kind of an option, so that viewers can have that knowledge, so that
Mhm.
if anyone who is suffering from alopecia areata, which is patchy hair loss,
Mhm.
they can look into homeopathic management. And going further to the area of skin disorders, one of the conditions that really bothers a lot of people in this country and across the world, and sometimes when someone is diagnosed with psoriasis, they have a great impact on their mind, thinking,
Mhm.
oh, this is something, I have no idea whether there is going to be a complete clearance of skin. And it is associated with a lot of because it's all about how our skin looks outside,
Right.
not
That's
when we are fully dressed and the skin is hidden inside. It's a different thing. But when it is seen on faces, on hands, on fingers, it really impacts
true.
anyone. So if you can give an example, if you have treated someone with psoriasis.
Yes. So again, psoriasis is an autoimmune disorder. It's a multifactorial disease. There are many causes behind it, but the most important is it's again an autoimmune problem. And what happens is that there's excessive scaling of the skin, and you might find silvery scales all over. As long as it is in on the knees and the elbows, people may not notice it, but when it starts appearing on the on the hands, on the palms, or on the rest of the body, then it becomes unsightly, and it sometimes the person loses the confidence. Or if, especially if they are the ones who are stage performers, there are quite a few stage artists and film artists who have developed psoriasis, and some of them also uh, lost the job because it was very unsightly and they no longer looked beautiful enough to be seen on screen. So this disease can start anytime from 5 years of age onwards. So it's not that it's a disease only of older people. Even kids can get psoriasis. And homeopathy works well in this condition. We had this lady who came to us with the generalized patches of psoriasis. She had them all over the body, including on the abdomen. She had some on the legs. She had on the arms. And once again, the homeopathic remedy was prescribed, not just on looking at the skin and giving something locally as an ointment, because it's not an actual local disease. It's an internal disease, as you said earlier, that has now come out. It's the body trying to express to you that I'm ill inside, and it's manifesting it on the skin. So you treat what is ill inside the body and not just the manifestation of what is now seen externally. So ointments never work in such cases. You need to give something internally, and you need to give it so that it targets the immune system. For that, again, a detailed history was taken. And as you will see in the slides, the person before and after, how it changes the appearance. Everything just clears out and the skin starts looking much more natural and healthy. No longer do you see those scabs in the scales. Sometimes other conditions also can be mistaken for psoriasis. Like, for example, we had one man who had been diagnosed variously by different doctors here as having eczema of the palms. Then they thought he had psoriasis of the palms. And they tried all sorts of local treatment. Nothing seemed to work. So they did a biopsy and they found he had a rare disease called pomfolix. And then he said, I think I have never improved with whatever the dermatologist has given me. Let me try homeopathy. And both these palms were affected, as you can see in the first slide. Everything is completely, it looks so bad that he would not even go out and meet people. In fact, he was in sales and he stopped meeting people because every time he brought his hand out to shake with them, they would look at his hand and they would cringe and they would try to avoid shaking hands with him because they thought he's got some infectious disease on his hand. Now, this person also, within 6 weeks of starting homeopathy, his skin completely, almost completely cleared out. I think within about 2 or 3 months, the skin was completely back to normal.
That's the great example. And these pictures that you have shared with us, Dr. Vaishnav, it really highlights the efficacy of the homeopathic management in this condition. So thank you for sharing.
Sure.
Now, I just would like you to also share how useful is this homeopathic management for chronic conditions, because we also see a lot of heart attacks, cardiovascular diseases, strokes, high blood pressure. So these are usually managed with national guidelines. There are national guidelines for every condition, and most of the time, patients who go to their clinical practitioners, such as primary provider, they are on medications such as beta blocker, diuretics, as per the national guideline. And these patients continue to be on those medications because they have to comply. How can homeopathy as a complementary and adjuvant therapy help these conditions?
A homeopath knows the scope and limitations of his method of treatment. If a person has an acute heart attack, he needs immediate admission into the ICU, or at least go to the emergency room and they'll take care of you and make sure that you are given the right management. If you have a stroke, once again, if it's an acute stroke, you need to first go to the hospital and make sure that everything is in order, get yourself checked in. They will test you, they'll do the MRIs or the CT scans. And if it's possible to dissolve that clot, they will give you medication to do that. And that is emergency treatment. And homeopaths do not deny that. You need help, you need to go for help, you have to go. You can't rely on treating yourself with just staying at home and hoping that just household remedies or even homeopathy or the alternative therapies would be of use. But having said that, I've used to see a lot of patients in our homeopathic hospital in India before I came to the US. So for the past 11 years, I've been in the US, but the 25 years prior to that, I was teaching at the college. And our hospital was like a primary care center. We had all sorts of patients coming. I've treated cases of stroke where the person has come in with the paralysis. We've given homeopathy and we've been able to make sure that they don't progress further. We have been able to preserve the movement of the limbs and they've gone back home walking. So acute serious conditions, you need to also make sure that you first get yourself diagnosed, get yourself treated, and homeopathy once again would be an adjuvant. You cannot use that as the main line of treatment at this point of time in the United States. A time will come when there'll be a lot of more research done and maybe there might be hospitals that could take care of it. But right now, the first thing you need to do is go to the emergency and make sure that you're well taken care of. But other conditions like acute bronchial asthma, it is possible to give homeopathy and bring down the acute bronchospasm very rapidly. Sometimes as rapidly as within 15 or 20 minutes, the patient's respiratory rate comes down, the shortness of breath is down, the cough comes down, and they start feeling much more comfortable. So even that otherwise could be an emergency, but it can be treated with homeopathic remedies.
So, Dr. Vaishnav, if I have to summarize what you have said, every acute emergency must be treated in emergency room, whether it is a myocardial infarction, which is a heart attack. Usually a patient will feel chest pain and a lot of swelling, sweating. And then if it is a stroke where there is a droop on the face and there is a loss of voluntary control, they must go to emergency room because the stroke can be treated only in emergency room through thrombolytic treatment. If there is acute asthmatic attack, then it definitely needs to be managed in emergency room or through their mainstream medication. But homeopathy can be considered as a complementary and adjuvant, which will actually support and strengthen their immune system so that they can have a speedier recovery comparatively. So this explanation for viewers is very important because we want to give them the right guidance.
Mm-hmm.
And thank you so much for sharing everything that you have shared with us today. And as I always say, when we are summarizing the interview and we are completing this episode, I always request our guest, the practitioner, if you have any message that you would like to share with our viewers.
My advice to all of you would be opt for homeopathy because it ensures a rapid, gentle, and permanent restoration of the health in the most reliable, in the shortest, and the most harmless way. So, as we talked earlier, emergencies apart, a lot of your chronic conditions and a lot of your other minor ailments you can treat with homeopathy, whether they are autoimmune disorders, whether they are chronic inflammatory disorders, whether they are hormonal disorders. You could use homeopathy, and in most of these conditions, you will find that the response is quicker with lesser side effects, and you should be able to lead a much better quality of life after starting homeopathy.
Thank you, Dr. Vaishnav. So, to conclude this episode, I would like to say to my viewers, there are many ways you can take care of your body. Homeopathy is one of that holistic medicine that can help you as a complementary and adjuvant medication therapy. But before you go in that direction, the best way to learn about how you can use it for your own self, always consult a certified and professional homeopath because they will be able to guide you in the best way. Also, remember, if you have any chronic conditions, if you are already under treatment of any chronic disease, if you are trying to include homeopathy as one more mode of medication, one more therapy, have a conversation with your primary provider. Discuss so that you have right information from not only from your primary provider, from your homeopath as well. This is our effort to bring you knowledge and information about many modalities which is out there, which are known as integrative, complementary, alternative, and holistic medicine. And in no way we are trying to replace the emergency medicine, which is very important in cases of emergency. So if you like this episode and if you learn something, then let us know how you feel about it. I'm your host, Varsha Singh for Healthline TVAsia Telugu channel. I will say bye, but before going, I would like to say thank you, Dr. Vaishnav, for coming on this show and sharing your expertise.
Thank you, Varsha, for inviting me today and allowing me to talk to your viewers. And I think I was happy to present the wonders and efficacy of homeopathy because that is one way in which you can restore your state of health. Thanks once again.
So one last question, Dr. Vaishnav. If anyone wants to reach out to you, where can they find you?
They could look for drvaishnav.com, the website, or they can call us on 408-201-3093. So we are in the West Coast. So California is 3 hours behind the East Coast. Keep that in mind and make a call, and then we'll be there to help you.
Thank you, Dr. Vaishnav. Thank you for your time and expertise.
Thank you very much.
This is Varsha Singh saying bye for now, but I will be back again with another practitioner who is practicing integrative, holistic, complementary, alternative medicine so that you can learn and you can take care of yourself in a better way.